Now, when it comes to the pandemic, over the past few years, we've seen a lot of changes with COVID vaccines, and it can be kind of hard to keep up.
This is what everybody has been waiting for, to be able to give the vaccine and to hopefully see this is the beginning of the end of the COVID issue.
Authorized by the FDA late today, booster shots for adults fully vaccinated with Moderna and Johnson & Johnson could be days away. It comes as the White House unveils its massive plan to begin vaccinating 28 million children.
As you can see, we've been through a lot of shots, but soon the FDA may simplify the schedule with, get this, just one shot. And like the flu vaccine, it would likely be updated every year for new strains. So far, the U.S. has gotten over 667 million shots in arms. But let's break down that number a bit, because the CDC says at least 8 in 10 Americans have had at least one COVID shot. But just under 70% actually did their two-shot primary series. And as for those updated boosters, well, that plummets to just 15% of Americans. So will a clearer booster schedule get more people vaccinated? Let's bring in NBC News medical contributor Dr. Uché Blackstock for some answers. She's also the founder and CEO of Advancing Health Equity. Thank you so much for being here, Uché. So we've had 2 doses, and those were followed by booster after booster. Now we're being told it could be just one shot. So what's the deal? Should we prepare for something like a yearly flu shot, but for COVID?
Well, Zinhle, thank you so much for having me. We'll see what the FDA advisory committee votes on this Thursday. But the thought is that they're trying to simplify everything for the American public. I think people are very confused. They want to increase those booster rates, as you just showed, they're quite low. And so they're saying, just like the flu shot, let's give an annual, annual COVID shot. And so the problem is, though, is that COVID is changing, mutating so quickly, more quickly than the flu shot does. So the question is whether or not are we going to be updating this flu shot more than a year? Are we going to need to do that and to update it on an emergent basis, as the FDA has said as well? And then also, COVID has a higher mortality rate than the flu does as well. And so I know that, they're trying to increase these boost rates. The question is, will an annual COVID shot, will that help increase these booster rates? And that remains to be seen.
And I want to follow up on something you mentioned, right? The fact that this would be an evolving type of vaccine based on the variation that exists. How exactly does that work? How would that work for a COVID shot?
Right. Yeah. So right now, what we're seeing with the booster is that the booster has both the wild type, the original COVID strain, and the Omicron variant. So it has 2 strains in it, whereas the primary series only has the original strain in it. But as we're seeing, almost every few months or every year, we have a new coronavirus. And so fortunately, these mRNA strains can be tweaked and updated. But the question is, are we going to be running after every new strain and updating the booster, or are we going to try to find more effective ways to vaccinate? So there are mucosal vaccines that can be given via the nose as opposed to an injection into the muscle. So that is a question. Those mucosal vaccines could actually be more efficacious than the shots that we are getting now, and can also prevent infection. There's currently research going on in terms of those mucosal vaccines. So we will definitely have to see. I'm concerned that an annual vaccine that's just updated once a year may not be enough, and that we are just seeing coronaviruses mutate so incredibly quickly, more quickly than many other viruses out there, that we may not be able to catch up.
Yeah, there have been a lot of COVID variations, and I'm sure a lot of people who are averse to needles would be happy to hear about the potential nasal swab as an option. And I also want to ask you about immunocompromised people. Would they have that same protocol of one vaccine if that became the protocol?
Right. So good question. So what the FDA is saying, for people who are immunocompromised, young children and the elderly, they would actually get 2 doses instead of 1 dose. So they would get 2 doses a year instead of 1 dose, because we know their immune systems are not as robust as a general adult population. So they would need a bit more protection. And with that extra booster shot, that increases antibody levels, and that should hopefully correlate to some improved clinical outcomes, like decreased hospitalization and death as well.
And Uché, as we're talking about outcomes, it's not lost on me that vaccine hesitancy has been a major issue with the pandemic. There are still a lot of Americans who have just never had a COVID shot, period. Not even a booster, not even a first or second dose.
Right.
Do you think those vaccine skeptics may be more inclined to get a solo shot versus a series of shots? And what's your message to them?
I think we'll have to see. You know, the vaccines have been out for a few years. People have had their opportunity to get their vaccines if they have wanted one. I think there probably will be a small percentage of people who say, okay, fine, it's once a year, sure, I'll get it. But as we already actually see from the flu vaccine annual shot, you know, it's less than 50% of the population actually gets a flu vaccine every year. So we're going to want those numbers to be much higher for the COVID vaccine. So that is my concern, that I don't know even if that annual shot will increase those increase those COVID numbers every year, but we'll have to see.
Yeah, and the big question I have to end on is, might this potential change mean that we're entering an endemic phase? What does our future with COVID look like?
Right. So I would just make sure the viewers understand endemic means that the virus is at a steady state, so at a steady level, and that we're not having these outbreaks and these surges. I don't think we're necessarily there yet. Hopefully, if we get enough immunity throughout the population, we will be there, but we're not there yet. We will be living with COVID. The question is, how pervasive will it be, and whether or not that we can really improve the research in terms of the vaccine. So we also want to prevent infection as well as disease and hospitalizations as well.
Absolutely. It's about keeping people healthy. Dr. Uché Blackstock, thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.